Thanks for filming today.
Easy.
We try to do well, you're good at the camera. You
Yeah.
and your wife do a bunch of...
Yeah, I was just recording just last night.
Yeah.
I call it, she does all the content, really. I call myself on-air talent. I just read the
Well,
teleprompter.
glad we've got the on-air talent today.
Yeah, you just tell me what the teleprompter, like I just read inflection, I'm just good at it. I mean, I do know most of it, but she's the workhorse, as you know, we usually are behind it.
Well, we don't need marriage therapy anymore.
No.
We just watch your stuff.
That's it, yeah. Pay attention to it.
So, where do you live?
I live in Mapleton.
Mapleton.
Yeah.
And you drive up to Lehigh every Tuesday morning from Mapleton.
Yeah.
Why do you do that?
Oh, it's all about the conversation.
Yeah.
It is.
Yeah.
It's conversation. It's not only is it that, it's about, being able to we discuss patience, right? There's an amazing learning opportunity that happens just here at Summit, like the thing that's been created, as I've talked to you before, is something I've never experienced in my career. So that part is just,
and how it's been, you've been doing this for 3 or 4 years.
Yeah.
Every Tuesday.
Every Tuesday.
Like clockwork.
It's just part of the thing. My alarm's set, I just get up early.
Yeah, well, I appreciate the support, and you guys have added lots of good insight.
We try. Sometimes it's not the best insight, but
it's good.
It's the perspective that we bring, I guess, which is nice.
I wrote a newsletter. I don't know if you read it. I quoted you.
I saw that.
Banking the muscle.
Banking the muscle.
Yeah, that's good.
I'm like famous for 2 minutes.
Not that famous from that, maybe from something else.
It was good.
I think about 5 people opened it, so that's
No, I love I loved the way that you framed that with, it like a 401k account.
Yeah.
Like you're making these deposits into your health. I thought that was great. You took my little thing and made it, and really expanded it, made it good.
In the world of physical therapy, does the facet joint come up in your conversations with patients? Do you think about it?
Oh yeah. I mean, that's because that's one of the things that I think we can influence on our side, musculoskeletal and support. Oftentimes the facets are really the driver of some pain and some pathology, and sometimes in the back it'll get stuck, and there's some mobilization techniques for that. But it's interesting because, as we pointed out in rounds today, like as the disc height starts to degenerate, there's all kinds of things that happen. But more often when we start losing disc height, which we all do as we get older, then the facets actually become, instead of this sliding surface, they become a weight-bearing surface, right? And as those facets start to just bear weight, now we're starting to just, they're beating them up a little bit more, and then they tend to get even more abused than they had initially. And I love the point that was pointed out where when we lose, when we start to have set problems, we actually lose lordosis, which then tips us forward, and that creates a whole other sequence where then the muscles start to spasm. The question that you asked, which I thought was insightful, was how do we then support, especially in the cervical spine, this loss of lordosis, and how do we encourage more lordosis so that we don't get that adjacent segment flexion to kind of adapt with it.
So when you're working with patients that are in this situation, which is basically every person on the planet eventually, what do you tell them? What can we do to prevent this, or to maybe delay it, or to have it be slower progressing? So
if we can maintain flexibility, right? The spine is this, I like to, analogous for the spine on my simple mind is really, I always say we have this chain of lifesavers, right? This little string of lifesavers we all started with when we were, 5 years old. And somehow 4 or 5 of those lifesavers got stuck together. That means that everything else has to move inappropriately, and so we have the segment that's stuck. Can we get these to move appropriately so that they're contributing to the overall motion? And the lumbar spine's so important. If the segments in the back are not moving appropriately, we need to get some motion somewhere else. And your body is amazing at adapting to these things, and it will find motion. Even if that means that the segments that are, the terminal segments in L5S1 is going to bend a whole lot more, which means more force across that disc. We use the credit card analogy, right? You bend a credit card in one place long enough, it's going to fail. So we need to get 4, 5, 3, 4, right? We need to get each of those segments contributing their component to movement and bending and flexing, and the same thing all the way through the spine. So having a healthy spine, one that moves, super important. So our goals really are, can we gain range of motion of the segments that are less mobile? We don't want to say stuck, but less mobile, even if it's just a little bit, because each segment doesn't contribute a lot, 2 to 3 degrees, 5, 6 degrees, but when you lose 5, 10, 15, 20, 30, right? When you start losing those degrees, you really start to have to engage in a different area.
I love that. I think from a surgical perspective, we're always trying to preserve motion where we can.
Yeah, absolutely.
And you're doing the same thing. Also preserving flexibility and strength, health of the bone, the ligament, the muscle, and it's all very important, because as that starts to degenerate and stiffen, I like that analogy, or that concept of the body has to find motion somewhere. And even if it has to really crank hard on one segment, which will wear out pretty fast.
Yeah, and oftentimes, as has been pointed out in rounds before, I mean, diseased segments, I don't really like diseased, but segments that aren't moving appropriately will end up causing adjacent segment problems. And then if we do that long enough, then they have to come see you.
Yeah, if you fuse a segment, then you have some problems at adjacent levels.
Right.
But it's also the natural history of a segment to degenerate, and a disc collapses or becomes stiffer. The adjacent segments take the load anyway.
Yeah, and as we get older, we get stiffer, right? Young babies, they take their foot and put it over their head, and that's because they have much more elastin, right, in their ligaments and their tendons. As we get older, that starts to shift. We start to get stiffer. So it's, as we get older, the emphasis really is, how do I maintain mobility, really good mobility? Because we can do things differently if we're more mobile.
Well, I love that in our morning conferences for many years now, we have chiropractic, physical therapy, surgery, pain management, and primary care, variety of other people. And we're all sort of taking our unique perspectives and trying to maintain motion, maintain flexibility, strength. Sometimes patients come and they have surgery, and we say, well, we think you need to go back to your physical therapist to do some things. And I'm like, well, I'm feeling better. Why would I need to do that? Or maybe they don't want to go and see a physical therapist because they think, well, I just have a problem, just go in and fix it. Whereas the reality is, I think that it's the combination of all of these angles of expertise coming together that keep us moving, keep us flexible, and hopefully allow for some good longevity in our lives.
Yeah, I mean, that's the goal, right?
Yeah.
Yeah.
Well, thanks for your continued support and sticking around after for a minute.
Yeah, thanks for having us. We love it up here.
Good.
All right.
Awesome. Thanks.